lovely people. A very beautiful morning, beautiful afternoon, and beautiful evening to every one of you. How are we all doing? I know we're doing amazing, all right. So guys, in today's video, we're going to be talking about A to E assessment of an asthmatic patient. You can see I'm already in my apron and I'm already in my glove. So guys, in a lot of settings now, in some of the centers where you may write, the assessor may make you wear an apron and a glove before entry into your station. So just in case they make you do your hand hygiene first, wear your apron and wear your glove, don't feel it is out of place. So in today's video, my assessor has told me wear my apron and my glove before I come to assess my patient. And she has also said to me, assume all checks are done. So if you're meeting me for the very first time, my name is Violet Okolacha, and on this channel I talk about everything good, everything positive, everything to make you pass your OSCE exam in one sitting, and sometimes some positive vibes here and there. Do well to like this video, share this video with your friends preparing for OSCE exam. Alright guys, so come with me guys and let's get started on A to E assessment of an asthmatic patient. So I'll be using my son as my patient. So guys, let's get started. Assessor has told me assume all checks as done, and I've put on my apron and my glove. So what am I going to do now? I'm going to be doing my hand hygiene even with my glove hands. Assessor has told me assume all checks are done, and she's made me wear apron and glove. So I do my hand hygiene according to World Health Organization. Palm to palm, right palm over left dorsum, vice versa, fingers interlace, fingers interlock, rotation of the thumb, tips to the finger, and the wrist. Assessor, my hands are clean. I'm just going to pick up my scenario and just have a little bit of giggle about my scenario. All right. So I'm having an asthmatic patient. All right. Hello.
Hi.
My name is Violet. I'm one of the nurses looking after you. Please, can I know your full name and date of birth, please?
My name is Haley Brooke.
Okay. And your date of birth, please?
15 February 1940.
All right. Can I double check that with your wristband? Is that okay? So I have here Haley Brooke, date of birth, 15 February 1940. I have here hospital number 100010. Assessor, with the paperwork on my hand, I can confirm I have the right patient. So Haley, can I please confirm with you, do you have any allergies at all?
Yes, I'm allergic to nuts.
Oh, bless you. So what happens when you take nuts?
I usually have rashes all over my body.
Oh, bless you. I see. That's why you're wearing a red wristband.
Yes.
All right. So nobody's going to give you anything at all that contains peanuts. Is that okay?
Okay.
All right. Fantastic. So, Haley, the reason I'm here this morning is because I want to assess you using the A to E assessment approach. Is this a convenient time at all?
Yes, it is.
Okay, fantastic. So, Haley, I'll leave you with the call there and I'll go ahead and assemble all equipment I need for the procedure. Is that okay?
Okay.
Are you comfortable?
Yes.
Fantastic. Thank you so much. So, assessor, I'm supposed to take away my apron, take away my glove, do my hand hygiene, put on another apron, and put on another glove. Assessor says, proceed. All right, so I'm still going to do my hand hygiene. So assessor has told me, proceed, don't take off your apron, don't take off your glove. So I'm just still going to do my hand hygiene according to WHO method. So palm to palm, right palm over left dorsal, vice versa, fingers interlace, fingers interlocked, rotation of the thumb, tips to the finger, and the wrist. So my hands are clean. Assessor, please can you confirm with me every of my equipment is clean and ready for use? Okay, thank you very much. So guys, I always advise you do the ops before dissecting completely A to E assessment. So Haley, I'm back. Are you still happy for us to continue?
Yes, of
All
course.
right, fantastic. So Haley, I will start with your airway. For your airway, because you've been talking to me, you know, I've asked you your name, date of birth, and you've told me, I can see that your airway is clear. There is no obstruction to your airway. Or are you having any obstruction to your airway?
Yes, I can't really breathe properly right now.
Oh, bless you.
Because of my chest, I'm having much pain in my chest right now.
Oh,
I can't
bless
really breathe
you.
properly.
Can you take a deep breath for me? Fantastic. Can I just pop up the head of your bed?
Okay.
How does that feel?
It makes it feel worse.
Oh, it makes it feel worse.
I can't still breathe right now.
Okay, that's fine. Can I calm you down a bit? Can you just relax for me?
Okay.
Take a deep breath for me. Fantastic. So assessor, in a real clinical setting, when a patient cannot breathe and according to the patient, the airway is obstructed, I'm supposed to stop the exam and call the emergency team, the medical team, so that we can attend to these patients. Are you happy for me to proceed, assessor? Yes, she tells me yes, she's happy to proceed. Do you feel a bit better now?
No, I don't.
That's fine. So I'm going to be escalating to the doctors. Your airway is not very patent and you feel is obstructed. Is that correct?
Exactly.
So just bear with me. I will escalate that to the doctors, okay?
Okay.
So for your airway, I can see obviously your airway is slightly obstructed. So I'm going to escalate that to the doctors, okay? So I'm going to be quickly doing a full set of observations on you. Is that okay?
Okay.
Fantastic. Can I see your left hand, please? Have you ever had surgery in your left hand?
No.
Okay, bless you. Are you happy for me to use your left hand to take your blood pressure?
Yes.
All right. So I can see your left hand. Sorry, am I allowed to do this?
Yes.
Okay, fantastic. So I can see your left hand. There is no swelling, there is no redness, there is no inflammation. I'm happy to take my observations, my blood pressure in this left hand. So I'm going to be tying my cuff 2 to 3 centimeters away from the cubital fossa. So guys, so Haley, keep taking the breathing breath from your right. Don't worry, your airway is going to be clear. The doctors are going to review you, okay? You're in the hospital for us to help you. So Haley, before I put up this machine, can I see your nail beds? If you could help me stretch your nail beds. Oh, bless you, fantastic. All right, so I can see your nail beds. Of course, your nails are very long, but there is no infection. I cannot see any infection. I cannot see any blemishes. I'm happy to use this nail. I'm happy to use your nail. I'm happy to do a capillary refill. I do a capillary refill. 1, 2, 3, 4, 5. It comes out to be less than 2 seconds. I'm happy with that. So I put my probe. All right, darling. Pop your hand down for me. I'm just going to put on this machine. So when I put on this machine, you may feel some tightness. Is that okay?
Okay.
Fantastic. So let's put up this machine now and see. Okay. Fantastic. So can I have your stopwatch, please, so that I can use to count the pulse? I need your watch to count the pulse. So guys, just make sure you do all you need to do. Like, of course. All right. So thank you very much. I'm just getting a stopwatch that I can count. Thank you very much. Your blood pressure is 143/68. Fantastic. So the patient name is already here. The patient date of birth is already here. The date of admission is already here. So I'm going to be writing my date now. Today is 18th of 5 and the time is 1400 and the patient blood pressure is 143. Make sure you check and you are chatting correctly. Very important. 143/68. 68, I think I have to do. So it is correct. And the patient saturation, imagine my saturation. The patient saturation is 94. Just imagine the saturation 94. Fantastic. So Haley, thank you very much. Can I quickly take this off you now?
Okay.
All right. Thank you for your cooperation. Can I just take your probe out of you? Fantastic. So Haley, please, can I count your pulse for 2 minutes? Is that okay?
Yeah, it's all right.
All right. Fantastic. If I use this hand, if that's okay by you, okay. I'll be counting your pulse for complete 2 minutes. Okay? I'll place my 2 fingers on your radial artery. So guys, I've counted the pulse now for 1 minute. I'm still going to put my hand there and I will start counting the patient's respiration. That is the rising and falling of the chest. All right, so guys, assume I've counted the respiration for 1 minute. Thank you very much, Haley. I'm just gonna chat. So to be fair, Haley, your pulse is 90 beats per minute, but your respiration is quite high, I must say. You're having a respiration of 25. So like you said, you're really breathing, you're fast breathing, and I can see that, and you're obstructed like you said. So Haley, is it all right if I check your skin now?
Okay.
All right, I'm just going to check your skin. I can see your skin. There's no excessive sweating. Of course, there is no redness. I'm happy to take the temperature. So guys, now this is what we are using for the temperature since March 25th. All right, are you happy for me to take your temperature? Fantastic. I'll just do it again. Fantastic. Thank you very much. Your temperature is all right. It is 37. I'm happy with that. You are alert, and you are not on any oxygen. No. You're not. So I have to escalate that to the doctors. You might benefit from some oxygen therapy. All right. Okay. Just be patient with me, okay? So patient is on air. The saturation is 94 and the respiration is 25. So I'm quickly going to do my news chatting now. Okay. So this patient is having a news of 4. But she is having 3 in a single parameter. So I'm going to be monitoring this patient hourly, escalating the care, and I'm going to be putting my signature. I will double check my news chart again, because remember what I told you, the most important thing is your news chart. I'll double check to make sure everything is correctly checked, signed, everything is there. All right, so Haley, thank you so much for your cooperation. I've actually done your observations, and from your observation, your respiration is high, all right? And so I'm going to be monitoring you every hourly. I will escalate your care to the doctors and to the nurses and to the respiratory team, and you will be reviewed promptly, all right? Okay. So you'll be seeing my face more often. Is that okay? It's okay. So Ellie, I've done your airway, and I'm moving over to your breathing. So for your breathing, I did your respiration. I counted your respiration for 1 minute, although I didn't tell you because I didn't want to obstruct the reading. But you're breathing very high. I can see stridor. I can see the use of respiratory muscles while you are breathing. I can see that there is visual signs of respiratory distress. So meaning that you're not breathing fine and we need to escalate your care, all right? Okay. So I did your saturation. When I did your saturation was 94. And the normal saturation is like 95 to 100, so it's not very good, okay? But don't worry, you are in the hospital for us to help you, okay? So we'll do our best to help you. You're a non-asthmatic patient, right? Yes. Fantastic. Don't worry, we are here to help you, okay? So I'm moving over now to circulation, all right? So for your circulation, I did your blood pressure. Your blood pressure was 140 something, 141 thereabouts over 68. Okay, that's not bad, that's good. I'm happy with your blood pressure. So when I did your pulse, you remember the one I was doing on your hand? Yes. So when I did your pulse was 90 beats per minute. The strength, the rhythm, and the rhyme of your pulse is okay. So I'm happy with your pulse, okay, because the strength, the rhythm, and the rhyme is okay. So I'm very happy with your pulse. All right. So and when I check your nail beds, remember when I was looking at your nail beds? Yes, I did a capillary refill. It was less than 2 seconds. You are properly perfused, okay? There is no cyanosis, and I'm very happy with that, all right? Okay. So I'll move over now to disability. Please, can I ask you, Haley, do you know where you are at the moment?
Yes, I do. I'm at the hospital right now.
Oh, you're in the hospital. And do you know what time of the day it is?
Yeah, it's afternoon.
Oh, fantastic. So you're well oriented to time, place, and person, and again, I'm very happy with that, all right? So Haley, can I ask you, are you having any pains?
Yes, just the chest pain.
Oh, bless you. If I ask you to score your pain, 0 being the least and 10 being the highest, what would you score for the pain?
Probably 7 because it's very severe right now.
Oh, bless you. Can I pop up the head of your bed again?
Okay.
Can you reposition yourself so that you sit up?
Okay.
Can you take a deep breathing breath for me? Oh, bless you. How does that feel, Haley?
It doesn't really feel good.
Oh, it's not getting better. So, Haley, I'm also going to escalate that pain, okay? Since it's not getting better, I'm going to make sure the doctors review you, the pain management team review you, and probably they could pop you on some analgesic, okay? Okay. All right. So, when they review, they will know what to do, okay? So, Haley, what about your urine output? How is your urine output?
My urine is very dark.
Oh
dark
my
urine.
God. Okay, you know what? I'll make sure henceforth we begin to monitor your urine output. That means we begin to monitor your intake and your output, okay? And because you said your urine is dark, I'm going to make sure I get a sample, okay? Let's just send some sample to the lab and see if there is any deviation from normal, okay? But are you drinking well? Because sometimes it's possible the urine might be concentrated because you're not drinking well. Are you drinking well?
No, I don't
Oh,
really drink much.
bless you. I think I might refer you to the dietitian. Is it alright if I refer you to the dietitian?
Yeah, it's alright.
Fantastic. So I'll be referring you to the dietitian, okay?
Okay.
Alright. So Haley, can I just quickly ask you finally for the disability? How is your blood glucose?
My blood glucose is okay.
It's okay. Did anybody take it today?
Yeah, somebody took it
Oh,
today.
and they didn't tell you the reading.
No.
That's fine. I'm gonna have a look at it and I'll come and tell you. But if they told you it's okay, then I'm sure it's okay. All right. So I'm going to move over to exposure. For exposure, Haley, I give your temperature and your temperature was 37, and trust me, that's fine. Okay. I'm not worried about your temperature. But can I just ask you, are you having any bleed in any part of your body?
No.
Any
I'm not.
wounds in any part of your body?
No.
Any rash?
No.
Any swollen,
No.
any redness, any
No.
bleeds,
No.
everything is intact.
Yeah.
All right, so that's fantastic. I'm happy with that. All right. So Haley, I've done your new score, and like I told you, you are having a new score of 4, but you are scoring 3 in a single parameter. So obviously, I'm not happy with your respiration. So I'm going to monitor you hourly, escalate your care to the doctors and to the nurses, and you're happy for us to do that, aren't you?
Yes.
So I just want to ask you one question, Haley. What brought you to the hospital? Because when I read in your scenario, I saw you had an asthmatic attack. So what brought you to the hospital?
Yeah, because of the way I was breathing today,
Okay.
it wasn't really good.
It wasn't
I can't really
good.
breathe today
Oh,
because
okay.
of the chest pain. It's very
Because of the
severe.
chest pain, okay. That's fine. Like I said, you're in the hospital for us to help you, and we'll do our best to help you, okay? But I just want to ask you, do you smoke or drink alcohol?
Yeah, I do smoke.
Oh, bless you. You know that smoking can aggravate your condition. You know that, do you?
No, I don't.
Oh, okay. So smoking can actually aggravate your condition. So because of that, are you happy? It's up to you entirely. But are you happy for me to refer you to the smoking cessation unit?
Okay, yeah, it's okay.
All right. So how many packets of cigarette do you smoke a day?
But 4, I can smoke 4
Oh,
packets
bless
a day.
you. 4 packets. That's quite high. But don't worry. I'll refer you to the smoking cessation unit. And I think if you quit, it's going to improve your health, okay? But it's up to you entirely, okay? So, Haley, can I just quickly ask you, do you comply with your medications?
Yeah, I do.
You take your medications as and when do you?
Yes.
Do you use your inhaler?
Yes, I do.
Okay, so Ellie, I'm just going to encourage you to keep up with what you're doing, because the more we take our medication, obviously, the more we get better. Is that correct?
Okay.
So keep taking your medication as you used to do. So I just want to ask you one more. How do you mobilize? Like, how do you mobilize?
I mobilized by myself, but
Okay.
today I can't really walk. I can't even stand up from here
Yeah.
because of the way I'm breathing.
So
today.
when you stand up, you feel like you're exhausted,
Yes,
like there's
yes.
reduced. Oh, I see. That's fine. We'll take it up from there, and possibly we might just involve the occupational therapy just to have a look, okay?
Okay.
Yes, we might just involve the chest physio as well, just to have a look. There's no harm, to be honest, okay? So I will escalate to all of them, all right? And you said you're not eating well and you're not drinking well, so I'm also referring you to the dietitian. So, Haley, can I just ask you the last question, my lovely? Do you have any concerns for me?
No, I don't.
Outside the breathing. Oh, okay, that's fine. So when I leave here, I will escalate to the doctors to see you, check you, and I'm sure they'll pop you on oxygen and start you on all the required treatment, okay?
Okay.
Thank you so much for your cooperation, and thank you so much for your time, okay?
Thank you
All
much.
right, so I leave you with the call there, and I'll make sure I take all my equipment, clean them, ready for the next use, all right? I'll take off my apron, I'll take off my glove, and I will do my hand hygiene. So guys, A to E assessment is just so simple. Really simple, trust me. So all you need to do is do what I've done. So what I did is I literally did my full set of observation before going to briefing, and I recommend this because it makes you, it gives you time to finish your news chat. But don't get fixed to any method. Do what do what helps you minimize time and what helps you to finish up. All right, make sure you check your news chat 4 times and make sure you are sure your news chat is correct. I will see you in another video. Don't forget to share. Don't forget to like. Until I see you again, guys, keep passing your OSCE exam. I love you all, guys, and bye. So do your hand hygiene. So I do my hand hygiene finally before leaving this video. Palm to palm, right palm over left dorsum, vice versa. Fingers interlace, fingers interlock, fingers interlock. Rotation of the thumb, tips to the finger, and the wrist. So tell me what you think about the video. My son has done a good job for heart and ask my patients. All right, guys, bye.